Modern life. Between careers, kids, and health, it can be mayhem. That's why we're here. I'm Dr. Lisa Varghese-Kroll.
And I'm Dr. Lonray Falusi. We're physicians, moms, and longtime friends who break it all down for you. Wondering how to juggle all the balls and still stay sane? Looking for advice but don't want to be overwhelmed?
Curious about how to make the most out of life for your family but enjoy it at the same time? You're in the right place. Welcome to Health and Home with the Hippocratic hosts. Are you one of the millions of adults dealing with back pain? Do you wish you could manage your pain with less or no medication? Pain specialist Dr. Saloni Sharma joins us today to talk about her new book and her drug-free approach to pain relief and prevention. Keep listening to find out lots more. Hey, Lon.
Hey, Lise.
Okay, so I am personally definitely taking notes on this chat today because my back gets angry on days that I get too focused on work and not focused enough on, moving.
Yeah, same here. And I know I have and you have, we both definitely have had patients and loved ones who tell us that they want ways to deal with their pain and improve their quality of life, but that, they don't want to get dependent on prescriptions or have to deal with the side effects of medications.
Oh, totally.
Yeah.
And I completely understand, right?
Mm-hmm.
Like, I think we all can all relate to that. So that's why we're happy to have Dr. Saloni Sharma joining us today. Dr. Sharma is dual board certified in physical medicine and rehabilitation and pain management. She's the medical director of the Orthopaedic Integrative Health Center at Rothman Orthopaedics and specializes in the non-operative care of musculoskeletal pain and dysfunction. She's also a clinical assistant professor of rehabilitation medicine at Thomas Jefferson University in Philadelphia, who has published numerous research articles and textbook chapters. Her new book, The Pain Solution, shares a drug-free approach to pain relief and prevention.
Which is very timely in light of the worsening opioid crisis. Mm-hmm. So we're really excited to hear about her novel approach. And as always, remember that this discussion is for informational purposes only and is not medical advice because none of us have actually evaluated you. So always consult your own doctor for any medical questions. That being said, welcome, Dr. Sharma.
Thank you. It's so great to be here. I really appreciate it, Lisa and Landry. It's really awesome.
We're just going to jump right in, throw you right in the deep end, because we think this topic is really important and going to be really interesting and relevant to so many people listening, including ourselves. So let's start from the beginning. In your experience, how prevalent is the problem of pain? What kind do you tend to see in your practice most often?
Sure. Yeah, thank you. Let's jump right in. So I see a lot of back pain. So I focus on neck and back pain primarily. Definitely see joint and muscle pain as well. But, back pain is really the bread and butter because unfortunately it affects so many people.
Mm-hmm. And with that, are there any common threads with the kinds of people who are suffering with pain?
So unfortunately, it really impacts everyone, either directly or indirectly. So as you may know, the lifetime prevalence of low back pain is in the 85% range. So almost everyone is going to be impacted, unfortunately, by back pain, whether themselves or a loved one or friend. And so I'd say it's sort of the common thread is being human.
Yeah.
So, we all kind of face back pain to some degree. And in the United States, it's actually the number one cause of disability. Wow. More than diabetes, hypertension. It's really something that takes us down and can keep us down if we don't have a game plan. I like to say that we have an opioid crisis because we have a pain crisis, and so I think if we don't start addressing the pain, then we really can't make headway with the opioid crisis.
That's a good point. And not to be punny, but that's really painful to hear that 85% of us will deal with it at one point or another. But it does mean that it is like a universal experience that we can all sympathize with, So given that we're still, experiencing the COVID pandemic, are there any new trends in pain or pain management that you noticed as we've collectively been going through this over the last couple of years?
Yeah. So, one of the big things is obviously telemedicine, which a lot of us have experienced either as a physician or a patient, on both sides. So that opened up a whole new access of care for some people, especially people who live remotely or, who for whatever reason can't make it into the office. So that was a silver lining, I guess I would say, out of some of the pandemic. Mm-hmm. But I think it made people more open to self-care in some ways, to trying things at home themselves, being a little more proactive. I think it also really highlighted the connection between stress and pain.
Sure.
So the pandemic, it was, stressful in so many ways, obviously physically, but also mentally and emotionally. And, stress worsens inflammation and it worsens pain. So I really think it impacted pain that way. And the newer stuff is things like virtual reality, those types of treatments for pain. In the past, they were used more for burn treatments and burn bandage changes. But nowadays, they're trying to use that for a lot of other things. I think personally the biggest thing is using things like mindfulness apps and just using the tech more that maybe people weren't engaging in before.
That's fascinating. Can you talk more about how virtual reality is used for back pain?
Yeah, so it's almost simulated mindfulness, right? So it's mind over matter. There is some data on it and some papers. It's not something, honestly, that I use in my practice, but it's something that people are exploring more and more. And it's almost like taking a break from your pain and being immersed in another world. And that breather can sort of help just sort of reset a little bit.
So interesting. Yeah, that whole world of tech in health is so fascinating. And it's great that it's being used in these helpful ways.
Right. And we've talked about that, right? Like about using a lot of these mindfulness apps. And we've talked about mental health for children, for adults. And it's good to know that, that people are becoming more aware of it and taking advantage of those resources.
And the point that you made around the pandemic increasing stress, which probably increased pain, but at the same time, the resources that were poured into telemedicine hopefully also increased access to care for people. So, interesting sort of balance there of kind of the impacts of the pandemic. So we want to hear more about your book. Really impressed that you wrote this really amazing book, and Andrew Weil wrote the foreword. So amazing. So
we'll
definitely link to the book in our show notes at hippocratichost.com. But tell us more about the book and what inspired you to write it.
Sure. Yeah. Thank you for that kind introduction about the book. So it was actually interesting because Lisa and I were talking about this before we officially started recording. Just like with your podcast, I think as healthcare providers, we feel sort of called to speak to a larger audience and provide help on a bigger scale and reach more people with treatments that they often, unfortunately, don't know about. So lifestyle changes, which is a lot of what my book focuses on, that doesn't get advertised with Super Bowl billboards and magazine spreads, right? Like, it's not like eat berries, exercise more, do yoga. Like, you don't see anything like that, but you sure as heck see things for certain pills and maybe some procedures. So I think it's sort of just getting the word out, about other ways to treat pain. And even if people, I am a physician, I'm not trying to say anything negative in general about the medical establishment, but these things help traditional medical treatments as well. So, starting at the root of the problem and working on stress and sleep, nutrition, relationships, and these are all things in the book, and exercise, all can make a medication be more helpful, can make an injection last longer, can make a surgery more successful. So it really goes hand in hand, and I would say enhances sort of conventional treatments for pain, especially back pain. And like we talked about earlier, the link between inflammation and pain, it's just undeniable. So if we can reduce whole body inflammation, we can really help ease pain as well. In my practice, it's primarily back and neck pain, like I mentioned. So my colleagues and I will see someone with back arthritis or stenosis, and it can be severe. So there's really a lot of pinching of the nerves and not a lot of space. There's a lot of if you see the back MRI with severe stenosis, you're like, oh my goodness, how'd the person walk in the room, so easily. And we'll see one person who really, it's really debilitating to them. Like, they really can barely walk into the room. They have the cane, they have the walker, they're moaning in pain. And then I'll see someone with the exact same MRI and they didn't even know they had arthritis.
Right.
Like, they had a backache for a couple weeks. And that's the difference, So as we all know, as physicians, people aren't diagnoses, but it's the inflammation that makes a difference. So just like someone has arthritis to their knee, it's always there. Sometimes it swells up and it hurts like heck, and sometimes it doesn't. and it's the inflammation. So if we can sort of lower whole body inflammation, through the ways we've been talking about, food, sleep, movement, stress, then we can get better quicker and hopefully prevent some future pain.
I love that. I mean, there are a couple of things that you just said that I think are really important. And one is, degeneration is a normal part of life, right? None of us will be able to avoid it if we age. So the question is, how will that manifest itself in our lifestyle? Exactly as you said, there can be two people with the exact same MRI who present very, very differently. And it's also so important, I think, what you said, that a lot of these lifestyle changes are not antagonistic to traditional medicine. They actually help with traditional medicine. And I think I know that's a conversation I've had with patients many times. I'm sure Lonre has as well. And it's a message that really needs to get out there. Like, if we want our, the medicines and the injections and the procedures that we're used to work at their highest potential, these are all sort of adjunct things that we need to be paying attention to. So I think it's really great that you're highlighting that. So that being said, your book is about a 5-step plan. What can you share about your 5-step plan to relieve back pain without medication?
Yeah. And I completely agree. It's sort of giving your treatments the best chance to work, right? It's like giving yourself the best chance,
Right.
And so it's called the Relief 5R plan because people like acronyms and catchy names, right?
Myself included.
Yeah. So the 5 R's are refuel, which refers to food; revitalize, which refers to exercise; recharge, which refers to sleep; refresh, which is mindfulness, mindset; and relate, which is relationships with others and yourself. And so that's the Relief 5R plan, and it's sort of based on the concept of we are what we consume. So, it's food and environment, right? So, I think a lot of people just think like, oh, you are what you eat, which there is some truth to that. But, it's also if, there's a negative person always around you and in your atmosphere and you don't get any break from that, that affects you too. And, people talk about mind-body connection and things like that. I mean, I think it's silly. They're the same thing, right?
Yeah.
So something that affects your mind affects your body. Something that affects your body affects your mind. Like, they're not like two separate planets. Like, it's the same thing. And so, like, if you go for a walk, guess what? It's good for your body and it's good for your mind, And if you're thinking of like a politician, or someone who you think of, who you don't care for at all, or like a really, nasty boss or an angry person, then sometimes your trap muscles, your neck muscles and shoulder muscles will get tight. Your heart rate will quicken. So, the body and mind are, essentially the same. And I think Western medicine tries to separate them out for many reasons. But in terms of pain, you really have to address both.
In a way that's kind of encouraging because you can kill two birds with one stone, right? Like if you're taking care of the if you're addressing one, you're going to help the other.
That's exactly right. Yeah. And so it's almost like a hack. So when in my mindfulness chapter and the refresh chapter, I talk about, you can't change your mindset overnight, but you can do something more physically active to get your mindset going the right way. Right. So that would be like, breath work is a common thing. I actually made up a term called an adult timeout. So, and that's in the book, but it's giving yourself 15 minutes a day that's just for you. And it could be mindfulness, but it doesn't have to be like a structured mindfulness app or exercise. It can just be something that puts you in the zone or in your flow state. So for some people that's cooking, for some people that's writing, for some people that's painting. It's just being present in the moment and allowing yourself that 15-minute break that reduces stress, that reduces inflammation, and that can help sort of break up a day just with a lot of overload. So, there's lots of little like techniques and tricks I have in the book. One is called a micro boost. So that's a lot of what the book's based on. So there are little steps that add up to big relief. So it's just little things you can do, like taking an adult time out to sort of help with your pain.
Oh, I love that.
I love that. Yes. But the pediatrician in me feels like the adult timeout is way more fun than the kid timeout. I have to say that. But what I love is that you're making it sound so like tangible and easy to do, right? 15 minutes. We have so much coming at us to be able to just turn around and shut it off for 15 minutes. You're not saying a 3-hour yoga session or, transcendental meditation for 18 hours, right? It's 15 minutes of the day that hopefully we can all find at some point. And what a benefit it is to our mind and our body, because as you said, it's one and the same.
Yeah, exactly. And that's sort of what we're trying to make it really practical, and so there's a lot of esoteric books that are exactly what you said, or things that cost a lot of money or time. So, having like a personal chef or a personal trainer or a massage therapist and, like kudos to you if you can do all those things and you can indulge in all those things. But, if you can't, like most of us, then it's trying to work in these little things that can add up to big relief and make a difference. I even talk about something called a gravity break. So I tell a lot of my patients about this. If you work a typical day, like a 8 to 5 day or 9 to 5 day, around 3 o'clock or 2 o'clock in the afternoon, if you can just lay down for 10, 15 minutes. This is especially true for my retired patients who maybe have a more flexible schedule. But even they don't do it. And I tell them you don't have to take a nap. No one's telling you, to change who you are. But you could read a book, you could watch TV, but literally all day gravity is compressing our discs in our spine, and just taking a little break, especially before sort of the bewitching hour. And as a pediatrician, you know that bewitching hour, but that evening hour before it's like dinner time and school and all this stuff happens, that can make a difference. I also talk about something called having like a refresh anchor bag, which is just like a little bag or bottle of things that bring you joy. So before or after you do something stressful, you look at a picture of your favorite person or, like a shell from the beach that was like memorable for you, or maybe it's a piece of gum, like just something that like brings you out of that sort of spiral.
Yeah.
And that's really what the whole concept is about, and the book is about, is like you said, practical ways to reduce stress and inflammation, just piece by piece. That's really bite-sized and easy.
That's really great. And just the concept of, you mentioned how Western culture tends to separate the mind and the body, and we just also don't take breaks for ourselves.
No.
Hardly ever until our bodies break down and then we're forced to take a break. Are there like particular aspects of Western culture, our jobs or the ways that our, cities are laid out that you think make pain more of an issue for us? And how can we combat those factors?
Yeah, for sure. And I think we touched on some of this, but yeah, exactly like you said, a lot of people work in sedentary jobs, meaning primarily seated. That's something the pandemic has increased for a lot of people. A lot of people working remotely, or even for social connection. If people are stay-at-home parents or retired, they're on the computer more for many reasons. And it's really getting up every hour and a half or hour. My brother works for Google, and he has a timer on his phone. I just kind of threw him out there, but he has a timer on his phone to literally do like some shoulder shrugs, neck rolls. I tell people, get up and pretend to go to the bathroom, pretend to get a sip of water. Like, you just have to move a little bit, because the more we sit, the worse it is. In the book, I also lay out some stretches people can do. I can put that on my website too, if that's helpful, that you can do at your desk. I've actually I've spoken at Google about doing a fake commute. So this was something that was popular during the pandemic, especially for people who work at home. It's when you are getting ready to start your workday, walk around your block or neighborhood as if you're going to work to sort of make a physical difference, right, from your home life and your work life. And of course, preferably you have a work area, and even if it's like a studio, at least you have like a work desk or space that's just for work. And then have a lunch plan, like have a packed lunch. No, you're going out for lunch, just like you would, when you were in the office. And then do the same thing on the way home, and really separate out mind and body, right? Like clear your headspace from work mindset to home mindset. Because a lot of people lost that commute and things got messy. And, with the constant input of emails and texts, even after hours for a lot of jobs, it can be hard. And so just sort of having a set boundary, I think, can be helpful. And then the other thing you mentioned about, things about Western culture that may contribute to sort of pain is the standard American diet. Have you guys heard this acronym, the standard American diet? So the acronym's SAD.
SAD.
Yes.
Yeah. So
Indeed.
Unfortunately, it is sad. So it's basically diet heavy on processed food and devoid of vegetables and fruits. And it's really contributes to pain, especially muscle, joint, and spine pain. And I wish more orthopedists and pain doctors would write scripts for nutritionists and anti-inflammatory diets because there's so much there. And like we said in the beginning, that can really just supplement and enhance traditional pain care.
Absolutely. I mean, I think we are both proponents of that for sure. So, it's so true that the pandemic really brought a lot of these issues to the forefront because so many people started working from home, because there was this blurring of the line between home and work became all the time. And I love that idea of a virtual or pretend commute because it's true. We don't have a lot of that separation other than our essential workers, of which, physicians are, but a lot of physicians were working from home as well. So, if you are one of the people who was affected either by the pandemic or by whatever other factor, and you've been experiencing back pain and you're ready to seek help from a primary care physician, what questions should someone be prepared to answer? What questions should they expect to be asked by their physician, and what questions should they be ready to ask their physician?
Yeah, I think that's a great question. It's a very practical question too, and like you said, we're trying to be practical and tangible for our listeners. So hopefully, if you have a good physician, they'll take a good history and ask you about when it started, if there's any factors that make it better or worse, if you have any associated factors. So there's some red flags sometimes we look out for, which can be loss of bowel or bladder control, meaning you lose control, not just like you sneeze, like as some people get older and they have, but it changes. If there's any radiating pain, like numbness or tingling, if anything helps it. So if there's any medications or positions, maybe a heating pad, if anything makes it worse. And of course, the biggest question is, was there an inciting event? Did something bring it on? I think something that people should let their physicians know is, one, if they have had it before. So not everyone asks that, and that's really important. Is this a pattern? Is this a trend? Did something help you before that maybe we could explore now? I think you should mention if you have stressors in your life, because that's not something your physician might jump to right away. But like we talked about, the mind and body are one. So, you can, and that's not, I just want to be clear, that's not to say that the pain's not real, that there isn't a physical issue.
Right.
It's just that it can exacerbate or worsen it or be a contributing factor. I think it would be helpful to ask your physician, what can I do to help now? So that would be more immediate treatments that they would probably cover already, like physical therapy or medications, but also what I can do to prevent future flares. And so I think that's developing a strong core in terms of back pain, specifically, once you're out of the painful flare. And it's really taking a look at your lifestyle, how does your food intake and how does your sleep or lack of sleep, how does your movement throughout the day impact your pain? And I have a lot of people who are older in the retired age group, and they can't walk 10,000 steps, right? There's this whole myth about the 10,000 steps. And there's actually an article in JAMA that said for women over 65, I believe, it's only 4,400 steps a day that increases lifespan, longevity, and health span. So, it's something you can break up throughout the day. You can take 3 20-minute walks. You don't have to do that 1 hour walk and then beat yourself up if you don't have the physical ability or the time with kids and work and other commitments. You can still get healthy and be healthy. And I want to go back for a minute because I sort of touched on a term without defining it, but lifespan is how many years you live. Health span is how many years you live in good health. And so,
That's
traditional
great to define
medicine.
that, yeah.
Yeah, traditional medicine is really good about lifespan, right? Focusing on lifespan, keeping people, alive as long as possible, and always evolving on that, which is great. But you really want those years to be lived in good health. And that's where, approaching these lifestyle factors makes a difference.
Oh, definitely. And, you touched on how important it is to try to find a good doctor. And for people who may have a difficult time getting in to see their doctor, whether it's limited access or full schedules or COVID restrictions or some other factor, what are your recommendations for specific home-based therapies along with the lifestyle changes like getting up, taking walks, that sort of thing? Are there particular exercises or stretches or other therapies people should try at home?
So you have to test it out, but a lot of people will start with topical treatments like ice or heat. Ice is really good if something's red and hot and swollen and clearly needs to be cooled down. Heat is good if it's like a muscle spasm. It feels like tight, like a rock. So at different courses in someone's pain, it could be different things. And that's why you might alternate. Yoga can be helpful. One of my favorite poses is just the child's pose, which is a really easy thing to Google, to find out. And it just sort of opens up the back and stretches it. If it's not severe pain, then it would be yoga, tai chi, mindfulness, those kinds of slow, steady stretches. And I'm not talking about like hot yoga. I'm talking about just traditional, slow, easy yoga to sort of work it out. That's what I'd say sort of for home stuff.
Those are great. Yeah, that's really helpful. I love the child pose. I love the like corpse pose where you're just lying on the floor. Those are probably my two favorites. The balance ones always take a minute, but those are great too. But again, I'm loving your advice because they're, again, like simple things that people can try. You're not saying, go get like a yoga club subscription and, spend an hour every single day. It's really just getting on the floor and stretching things out, and that can be part of your daily regimen.
So let's say that conservative measures haven't worked for someone with persistent pain. So you and I are both rehabilitation physicians, which is a specialty. A subspecialty of that is pain management. So can you walk our listeners through the process to find a specialist or subspecialist that can help?
I think it's really talking to your primary doctor and seeing who they trust. If you trust your doctor, then I would trust their recommendation. That's what I recommend. I think it's also good to talk to friends or family members, especially, people you're close with, to see what experience they had with a pain physician or other specialist. And then after that, I would still take the next step of going onto the practice or hospital website and seeing if they seem like a good fit for you. So like, for example, if you go to my practice's website, you'll see that I was trained in acupuncture, that I was trained in mindfulness, and whether that sort of fits with something you're interested in or not, I think makes a difference.
You've given us a lot of great food for thought. Are there any additional resources on pain that you recommend to patients or that you want to share with our listeners?
In terms of other resources, there's a lot on my website, and it's all free and open to everyone. It's the things we talked about with nutrition, mindfulness, and it's little pieces, really little pieces of inspiration for the book too, or basically in the blogs. So I think that's a great place to start. Obviously, I have to say the book. You can't
Of course.
You'd be surprised by that. I mentioned that. And then I do like some of Andrew Weil's site. Dr. Andrew Weil, he has a website too, if you're looking more for like lifestyle and integrative treatments. But I really think the best thing is to talk to your own physician, and if you need to, a physical therapist who can guide you in the right direction and sort of be hands-on. A lot of this stuff isn't generic, and you have to sort of customize it to what works for your life.
Sure.
Absolutely. Thank you so much, Dr. Sharma. That's just been so helpful. You've given us a lot of, as we've said several times, really practical things that people can take and, pick and choose the things that are applicable to each of our lives and hopefully really see great results from. And we're so excited to read your book, The Pain Solution: 5 Steps to Relieve and Prevent Back Pain, Muscle Pain, and Joint Pain Without Medication. And this book releases the same day as the release of this episode, May 17th, 2022. So congratulations on that. And we're excited to see, all the different people that we know it will help.
Thank you so much, Lisa and Lana. It was so great to be here, and I really appreciate what you're doing too. I really enjoyed some of your other episodes about COVID and mental health. I think that's such an important topic. Yeah. And it's so nice to see people going sort of out of their typical roles just to make a difference and help people. So thank you too.
Oh, thank you. Really appreciate that. Thanks so much for joining us today. It's been a pleasure. Thanks so much to Dr. Saloni Sharma for joining us and sharing her expertise on managing pain. We hope that every one of you listening learned something that can help either now or in the future. So for a link to her new book and other resources on back pain, check out our show notes at hippocratichost.com. That's our show. As always, we really appreciate you listening. Thanks so much for joining us. Don't forget to follow us on social media. We're on Facebook, Instagram, and Twitter. Our handles are at Hippocratic Hosts. And, if you like what you hear, subscribe, tell a friend, review us on Apple Podcasts. We would love to see you. All right. Thanks so much.
Thanks, everyone. Talk to you soon.
Thanks for listening to Health at Home with the Hippocratic hosts. Remember that all views expressed here are our own, not our employers, and all content is for informational purposes only and should not be construed as medical advice, nor the establishment of a doctor-patient relationship. Always consult your own physician or healthcare team for any medical issues.
If you enjoyed this episode, please rate us, subscribe, and tell a friend. And check out our website at www.hippocratichosts.com for show notes on this and all our episodes. Can't wait to chat with you next time.